everyone, and welcome to the Conference on Asia Pacific American Leadership's Washington Leadership Program. My name is Tran, and I am on the Board of Directors for CAPAL. The Conference on Asian Pacific American Leadership, CAPAL, is a nonprofit organization that builds Asian American, Native Hawaiian, and Pacific Islander, or AANHPI, public service leaders by providing formative professional experiences and growth opportunities. It is my pleasure to be introducing you to our Washington Leadership Program. WLP is one of our signature programs that introduces students to Asian American, Native Hawaiian, and Pacific Islander leaders in public service who can inform and inspire students own civic engagement. Our WLP theme is reflection and resiliency, emphasizing the ability of communities to come together and catalyze momentous change through these unforeseen times. Through these sessions, panelists and attendees will reflect upon events leading up to 2021, emphasizing how communities unite to reflect and demonstrate unyielding tenacity and resilience, even in the face of uncertain and demanding circumstances. All WLP sessions will be recorded and live streamed to our Facebook page and will be available for later viewing afterward, including materials. I would like to welcome you to today's session, Self-Care is Community Care, AANHPI Mental Health and COVID-19. This session will address the effects of the ongoing COVID-19 pandemic on the AANHPI community in terms of mental health and wellness. Key topics of discussion will include overcoming barriers to access to resources, addressing the mental health stigma in the AANHPI community, and discussing ways in which to cope and support others. Please follow and join our conversation tonight on social media using the hashtag #WeAreCAPAL and tag us at CAPALDC. There will also be a short survey that will pop up after we close the session. We would greatly appreciate your feedback. And with that said, I would like to begin by thanking our speakers and panelists this evening for spending their time with us, and to you all for joining in. And a very, very special thank you to our 2021 sponsors for making programs like tonight possible at CAPAL. Tonight's program will consist of a self-care activity, a panel discussion, and Q&A. Please submit any questions you have into the Q&A box, and we will close out afterwards. And now, I am pleased to introduce Jennifer Chang to set the stage for our panel with a self-care and mindfulness activity. Jennifer J. Chang, she, her, is a PhD candidate in counseling psychology at Teachers College, Columbia University, completing her doctoral dissertation study about Asian American activists and their experiences of racial, ethnic, and activist identity development. She holds a BA in psychology from Bryn Mawr College and a Master in Education in Mental Health Counseling from CUNY Queens College. Jennifer wears many hats as a therapist, researcher, scholar, activist, organizational consultant, facilitator, mentor, friend, daughter, sister, and proud auntie. Her work as a researcher and clinician focuses on multicultural issues and the co-development of intersectional identities, with a specialty in Asian American psychology. With over 20 years of nonprofit and community experience, Jennifer is a skilled youth educator and nonprofit trainer with expertise in leadership development, managing group and team dynamics, destigmatizing mental health, utilizing mindfulness for social justice, and addressing issues related to diversity, inclusion, and equity, such as racial microaggression, LGBTQIA+ inclusion, and other topics. As a consultant, her mission is to empower individuals and teams to manage diverse organizations with more mindful co-leadership, and also facilitate difficult dialogues with more confidence and cultural competence. Her guiding model in this work is leadership comes in all shapes and sizes. On to you, Jennifer.
Thank you, Tao, for that very warm welcome. I'm gonna have the slides shared for a second, and while that's happening, I just want to say how happy I am to be here today with everyone to lead you all on a warm-up activity before our panel. And I thought the perfect way to get our brain juices going would be to do a self-care toolbox activity. And some folks call this a self-care plan, but what I and many others learned during the pandemic is that even when you have the most well laid out plans, sometimes you just have to toss out the window, right? And so toolbox and thinking about it as a toolbox helps us to think about using these tools at any time. Next slide, please. So in the spirit of today's topic, self-care is community care, I'm going to have everyone link to an idea boards to brainstorm all the ways that we take care of our body, our mind, our spirit, and also our community. And what I really love about doing this activity is that we can really dig into our collective wisdom as a group of 40 or so people in the Zoom room to create a community toolbox. And it looks like on the slide where those question marks are, there should be arrows pointing up and down. And so that collective wisdom and the community toolbox are all feeding into each other. And so this is especially a great activity for folks who are maybe a little bit more isolated or interacting with a smaller group of folks, because my hope is that you'll be inspired by other folks' ideas for self-care. And so we're gonna unshare this slide while folks go to that link that was just placed into the chat box. And if you've never used idea board before, it's really, really easy. I see that folks have already put it in. And so you basically click the plus sign and put whatever you want in that category. And if there are certain ideas that you really, really love, what you can do is click on the number on the bottom corner and you can upvote. And then it'll update. So we'll do that for a few minutes. A lot of great ideas so far. What you might notice is that there may be some repeat ideas across categories, because as we know, some of our self-care strategies help more than one thing, right? More than just our body, more than just our mind. And what we also know from is that our body, mind, and spirit are all connected, right? So a lot of great ideas. I see a lot of exercise, running, eating when I need to, doing yoga, sleeping well, taking walks and doing stretches to take care of your body, taking care of your mind with meditation. That one got a lot of upvotes. Journaling, sleep here again, breathing techniques. Oh, no meetings Mondays. That's a really great idea. Reading, downtime, taking care of your spirit with me time, cooking comfort food, meditation, here again, oracle reading and quiet time. There's so many good ideas here. And taking care of the community through organizing activism, karaoke, yeah, singing and music. That can take care of all 4 of these categories. Having safe spaces to talk, providing on language, story sharing, right, access to resources, supporting local businesses, addressing colonization. So many great ideas. do this for maybe another minute or two. And as you can see, there's so many ideas, they like don't even fit on one screen. So I definitely encourage you all to keep this tab open to look at for later, because you might see some things that you didn't quite see just right now. So many awesome ideas. Thank you. So let's switch the share screen right now. And if folks still have some ideas that they're, feel free to keep adding those to the post-it notes. And so we're going to share the slides again, please. Thank you. Okay, great. So there's so many different ways to think about this activity. We can call it self-care toolbox. We can call it a self-care plan. And you can use words or you can use images. I really love this image in the middle where it says 50 ways to take a break, all these really cute drawings of ways that you can stretch or take a shower or, do something or crack jokes with friends. And then there are also different categories to think of too, not just mind, body, spirit, and community. Like if you look at the example on the top left, there's also another category for heart. On the top right, the self-care plan uses different words, how to take care of yourself in terms of mental strategies, physical strategies, emotional strategies. And the bottom one, where it's a self-care wheel, there are also options for how to sort of tease apart, am I taking care of myself personally and how am I taking care of myself professionally? And so what I love about this activity is that it's super, super versatile. And it was actually inspired by the self-care plan that you see on the bottom left corner, where it says Ignacio self-care plan. So you have a mind, body, spirit. And then on the left, you have a place to write down all the people who are in your support network, and on the right, all the goals that you hope to accomplish. And this template, which we're going to be sending to you after today's talk, comes from a website called Social Work Tech. And it was created by a psychiatric social worker named Ignacio Pacheco. And I really love it. And so there's so many different ways to do it on paper. And so now, after we've brainstormed all these different ways that we take care of ourselves and have seen like all the different ways that we can sort of organize all this information. Next slide, please. The task is to build your own toolbox, right? And to personalize it. And so I definitely encourage folks after today to use and reference the idea boards brainstorm for inspiration, to really, access that collective wisdom and to also be creative. You can, create a toolbox using paper, markers, and colored pencils to write and draw, or you can use a physical box, like take a shoe box and put all your favorite calming objects, like a something like a furry stuffed animal, or a grounding stone, or crystals, or anything like that. And maybe a list of some other strategies as reminders, reminders to go pet the dog, or reminders to go take a walk, or to listen to that special playlist you put together when you're in times of stress, right? And then if you want to go digital, you can go digital as well. So you can type up the list of strategies on Google Doc or in the Notepad app in your phone, or you can download apps like the virtual Hope Box, which I really love because it sort of splits things up into 4 modes: distract me, inspire me, relax me, and then coping tools. And it's super, super easy to navigate and personalize, especially when you're in, high stress moments. And then my final piece of advice is to do this sooner rather than later, because what we know is that when we get super, super stressed out, our brains just are not working the way we want them to, and our memory is a little bit more fuzzy. And so if we can brainstorm and strategize the self-care tools that work best for us now while we're calm, it'll be so much easier to be able to access those tools later on when we're super stressed out. And so that's about it for the self-care activity. I hope you enjoyed it and it sort of, got your brains going for the rest of today's panel. And I hope you'll follow up and create your own. And I'm gonna pass it on back to Tal.
Thank you so much, Jennifer. That was fantastic. And I always don't prioritize these things. So it's a great reminder to do the plan and put it up somewhere so that I actually do it. So thank you so much for leading that. I'm so excited to hear more from our panel. So now the moment we're all waiting for, please give a very warm welcome to Matthew Miller, who will be our moderator for this panel. Matthew will also be leading the discussion and the Q&A. Matthew, I'm handing it off to you.
Thank you, and thank you for showing up, everyone. I know you're all busy, and I appreciate that we can spend this moment together and learn more and hear more and think more about self-care as community care. I'd like to take a minute and just allow our panelists to introduce themselves, and maybe we can popcorn. Can I popcorn to you, DJ, first?
Sure. Thank you. And thank you, Jennifer, for that intro. I think this is self-care, something we all forget to do. So it was really a nice way to start. So my name is DJ Ida. I'm Executive Director of NAPIMA, the National Asian American Pacific Islander Mental Health Association. And very briefly, I have my doctorate in clinical psych, and I've been working with the community on mental health issues for over 40 years and working with community-based organizations around the country, which has really, I think, been the thing that I've enjoyed the most, so working with direct services and policies. And I will popcorn over to Krystal.
Thanks, DJ. Hello, everyone. My name is Krystal Canary. My pronouns are she and hers. I was thinking about what I would say during this introduction, and I think I want to start off by sharing that, I was a recent graduate, maybe less than a decade ago, and I went to a CAPAL leadership event on mental health. And that is where I met someone that was a mental health advocate that led me to joining SAMHSA, the Substance Abuse Mental Health Services Administration, and hearing her story, hearing about the stories of Asian Americans and their struggles with mental health and trying to figure out what their mind, body, and spirit was and how to take care of it was something that inspired me to go off the pre-med route into public health and mental health. So just happy to have this coming full circle opportunity to talk to you all. And I'm looking forward to the conversation. I'm here representing myself, but also I currently serve as the Vice President of the Asian Mental Health Collective. I'll talk a bit about them later, but they are a recently formed nonprofit organization dedicated to normalizing and destigmatizing mental health in the Asian community. So happy to be here. I'll popcorn it over to Angela.
Yeah, thanks so much for, Angela, you said, I'll stop talking.
Hi, I'm Angela Edward. I identify as she, her, and hers. I'm located in Michigan. Before anything, I call myself a Micronesian American daughter, sister, auntie, and I'm a social worker. I'm a mental health therapist. And so I work directly with people on just anything mental health related, self-care related. And my specialty is working with Micronesians, Pacific Islanders, or people who are very plagued by racial imposter syndrome. So yes, Angela, I'll go to you next.
Yeah, hi. Sorry about that, Angela. Whenever I hear Angela, I hear my name. It's not the first time that's happened. So thank you for allowing me to do that. Hi, everybody. My name is Anjana Sridhar. I identify as an Indian American. My pronouns are she, hers, and herself. A bit about me background-wise, I currently work in healthcare operations at a major academic medical center in New York City, where I do a lot of work with our psychiatry service line. And it's interesting to see how that service line has approached issues of mental health, especially as it relates to people of color, and of course, specific to this group as it relates to Asian Americans and Pacific Islanders. And I'm also a recently published author. In December of 2020, I published a book titled Healthcare of 1,000 Slights. And a high-level summary of the book is that it's about the history of health disparities among different marginalized populations in the United States. And I do have a chapter focused on Asian Americans and the role of immigration policy, racism, xenophobia, et cetera, on health outcomes in that population. So excited to be part of this group. and then I'll popcorn it off to Jennifer.
Thank you. I already watched a long in the beginning, so I won't say that much more, except to say my name is Jennifer Chang. I'm a doc student at Columbia, and I use she, her, hers pronouns, and I'm just super happy to be here to talk about this really important topic.
Thank you all for those intros, and I'm always inspired to hear about the excellent work going on with people around me. So I look forward to hearing more from the panel. And for those of you who are attending and listening, just remember you can ask questions in a little bit. So feel free to start thinking about those, and you can enter those in the chat, and we can try to get through those in a little bit. But starting us off tonight, the theme is self-care, is community care. And so, we are living in a very difficult time, and it's not to say that the history of AAPI populations is all warm and fuzzy and rosy, but we certainly are living in a time that is challenging. And so the question for the panel right now is, how have you been coping during the pandemic, and have you found any new ways of or routines or habits to help cope? And are you adjusting to this quote unquote new normal?
I'll go ahead and start off. It's been a real mixed bag this past year. And I think because all of us are working in the mental health arena in one way or another, I have found that if there's, and I say this with huge quotes, if there's anything good that came about this, the pandemic and the anti-Asian racism, is it's raised awareness around mental health, but it's been at a very terrible cost. And I think what we're seeing, and I know that I personally have felt just exhausted and going through full range. There's times when it's energized me to work more with the community, to design programs, to work on projects we've worked on. But there are other times, it's like after the shooting in Atlanta, a friend of mine called and said, "How are you doing?" And I didn't realize all that I was holding in. Because for those of us working for the community, it's our job to hold it together to help others. And I didn't fall apart, but I just felt the tears right at the edge. And I began to really realize, and it also put me back in touch with a lot of the trauma that my parents went through. I ended up being born in Denver because my mother was forced out of California because of Executive Order 9066. And in talking to communities around the country, that's one of the things that I've seen, is that this was triggering old traumas. And each of our community experiences trauma differently. So I think it's been a year of reflection, a year of finding new strength, trying not to give in, and really also finding places, which is why I really appreciate what Jennifer was doing. It's finding ways of self-care, because it becomes even more important. So it's just some of the things that I felt over this past year.
Yeah, to piggyback off of that, when I think about that question, it's really hard to answer, because I, wonder to myself, should I go the optimistic route? Should I be fully honest? Because if I'm fully honest, even with all my training, even with all my self-care practices, I have been struggling a lot. And I'm sure a lot of other people in this Zoom room have also been struggling a lot. And, as folks are talking about, lifting lockdowns and, the new normal and that kind of stuff, I hope that folks know that it's okay to be still struggling. And that if you're still feeling anxious, depressed, fearful, angry, whatever it is, whatever feeling words you are experiencing right now, it's okay. You're not alone. And despite all the pressures from family, friends, or the media to get back to normal, whatever that is, it's okay to have your own timeline, And I think definitely for a lot of people, not just myself, this last year and a half has been a time of a lot of reflection and figuring out what is working and what is not working, right? And I think in the pandemic, we had to like lower our standards a little bit, right? Like if I can get up today and take off, like change out of my pajamas, that is like a really huge success. And so, yeah, I have, tried out different things, and I, to combat isolation, because I live by myself, in terms, for example, instead of meditating by myself, finding online meditation groups to join or healing circles, that has been really helpful. And just being more intentional about not having too many days pass by without any like social contact.
Yeah, thanks, Jennifer, for saying that. I had similar feelings of not knowing how to answer this question because it feels like everyone is saying we're going back to this reopening and things like that, but it doesn't feel like we ever, I feel like we're still very much in this pandemic. And for myself, reflecting back at the beginning of this pandemic, the way I coped with it was really figuring out what was essential to me. And the moment I figured out or found out we were on this stay-at-home order, I ended up going home back to Maryland and going and staying with family because from what I was hearing with my family, they were having troubles with communicating to their bosses what safety looked like for them. Some of them were even told that don't wear a mask, people will think something of you. And so even early on, my gut reaction was what's essential is family. And the way that I really held on to like finding my strength was surrounding myself with loved ones and figuring out what a lot of my friends and I would say is like, what is this playbook on how to protect our families really? And I not going too much into it, but when we said, how do you take care of community on the idea board, I was the one that wrote like community care is like activism and community care is like community organizing. And so to be quite honest, the way I've been finding resilience and feeling like I'm navigating this and feeling okay about it is being closer with community and recognizing that I play a role in this and really reflecting on what that role is. And so, yeah, right now I'm kind of holding a lot still as I think about it because of the continued violence in our communities, because of just everyday things that continue to happen and will continue to happen. And so I would say, like the other panelists, really checking in on yourself and really being in tune with how you're feeling every day and giving yourself grace. My one friend says like snacks, snaps, and snap and sips of water. He's right across from me. He was like, it's sips of water. Just making sure that every day you do that and that's enough.
Thank you, panelists, for those comments. I really resonated with the idea that it ebbs and flows and there is no one way, which I think is really freeing, that there's no one way to respond to this and there's no one timeline to cope and heal and make meaning. So thank you for that. I really resonated. And so for those who are attending or just showing up, we're talking about self-care as community care. We have a number of questions, so I, as moderator, am going to just kind of ask some, and different panelists will have a chance to respond, just so you know. So another question here is that we know that mental health has always carried certain stigmas and unique stigmas in PHI communities. Where do you think these stigmas originate, and why do you think for some they are so meaningful and persist in some of our communities?
I guess I'll jump in here really quickly. I think it's important to keep in mind that Asians and Asian Americans are not a monolith, right? So there's no one way that everyone thinks or feels about mental health and illness. But what the research shows is that there are definitely some communities where stigma is more prevalent, including Asian American communities, other communities of color, some communities of faith. And sometimes this is related to the fact that there is more a sense that mind, body, and spirit are all connected. Whereas in Western, psychology, it's much more separate. And so sometimes mental health concerns are dealt with either within spiritual communities, or they might show up at, when you're going to your primary care doctor because, you're having stomach aches or something like that. So they might emerge like more somatically. And there are a few, and I think one important factor too is thinking about the model minority myth and how there's this idea that Asians don't experience racism, that we don't experience any difficulties, that we're doing well and we don't struggle, right? And so that is really problematic, because what that means is that there's no space to actually talk about when there is struggle, when there are difficulties. And the traditional cultural values that some of us may have grown up with, that also may contribute as well in terms of, trying to talk about mental health difficulties and feeling like it might bring shame to the family, shame to the community. And so there's that, and there's also lack of visibility. We need to have more conversations like the ones that we're having tonight, right? And then the final point is that, there also needs to be a lot more cultural competent care, care that is, really meeting different communities where they're at.
Yeah, thank you for sharing that. And then especially that last point. I'm a mental health professional and a researcher, and I know the literature on stigmas. And one critique I have is that it really makes it about AAPI communities as a deficit, like there's something wrong with them that these stigmas exist. And for me, it's always, I think it's more that historically mental health professionals and the way that we address it is not is not appropriate. It's based in a different cultural and value system. So I like to try to externalize the idea that stigmas represent something wrong with our communities. No, it's more that historically the way that mental health field emerged is it has not been responsive to our communities. So Jennifer, you mentioned model minority. So the kind of follow-up question to the panel is that we know that stereotypes like that we're all the model minority really kind of masks or confounds the realities of our communities. And when we look at disaggregated data, we see different degrees of access within our communities for accessing and coping with mental health. Can the panelists speak to kind of this model minority, the different realities within our communities in coping and access to support?
I can kind of jump on that one. So as a Pacific Islander, I think it's really important to recognize that putting all of us together in this group is only hurting us. I'm personally a strong advocate for separating data between Asian Americans and Pacific Islanders. And I think that lumping all of us together is really just perpetuating a system where all of us are inappropriately given resources based on numbers that don't actually represent us. So like a good example of that is the Stop Asian Hate movement. I think that Pacific Islanders were included in that. And I think that there were not as many hate crimes on Pacific Islanders as there were on Asians and Asian Americans. So that's a very clear example that the numbers were probably far higher than what was even showed, even with the numbers being as high as they were. And in terms of a public health crisis, COVID-19's pandemic was a very recent example of a public health crisis where, like in Northwest Arkansas, there was a time where more than 70% of the deaths from COVID-19 were from the Pacific Island community alone, specifically the Marshallese community. And if they would have added Asian Americans to those numbers, it really would have just made the data flip-flop, and you wouldn't have been able to see where the resources were needed. And I just believe that mental health is no different. And I think we need to recognize that the disaggregated data really isn't contributing to the mental health crises that's in all of our communities. And we really just need to find ways to fight for all of us to not be under that big umbrella, because we're all suffering from the model minority myth.
If I can tack on to that, I think what's really interesting is that the model minority myth, to Angela's point earlier, is that it tries to group the histories of a variety of different groups and create a singular narrative, when in fact the immigration patterns of, to bring up a couple of examples, immigration patterns of folks in the Chinese community are different from the Korean community, which is different from the Micronesian community, which is different from folks who are from Guam. And so the data, when it's fully aggregated, doesn't reflect those patterns and those histories, which ultimately contribute to the mental health crises in respective communities. And so I also am a big advocate for disaggregating data and using that disaggregated data, to inform resource allocation and what it looks like for different communities to come together. At the same time, though, I think it's important that we walk a fine line, because if we're completely disaggregated, then we do lose the ability to stand in solidarity together. So we need to be able to hold both in tension. The data itself needs to be disaggregated from a resource allocation perspective. But when it comes to amassing a certain level of social and political capital, there is something to be said about the power of solidarity there.
I'd just like to add all the comments I completely agree with. And there's another part going back to the original question around the stigma around mental health. And it's oftentimes the way that we look at mental health. And we always look at mental health from a deficit model. So it's building on what everybody said. And then there was a particular comment that you said, Matthew, about we look at it from the problem standpoint. If you are different, that's pathologized. But the other thing that we do is if you have a mental health problem, that's pathologized. In doing the clinical work, I saw this over and over where people were afraid to accept a diagnosis because they felt like it was a one-way street. It was almost like a death sentence. If you have this mental health problem, you are less than, there's something wrong with you, you're crazy. All these really negative impacts. And what we need to do is to educate that, one, we need to take a broader public health approach. The Western way of looking at it is there's something wrong with the individual. It's the medical model. There's something wrong with you versus looking at what are the systemic issues that impact our communities, that what you're seeing is a symptom of a very racist or very insensitive system. And what we're doing is responding back to that. The other is somebody who may be having a very serious diagnosis. It could be schizophrenia, bipolar disorder. And when people see that if I have this, hang it up, it's just all over. And we know that's not true. And so if we believe that people don't get better, why would people want to go and acknowledge the fact they have a problem? So part of it, and it goes back to all these other comments, the way that we heal, the current service delivery system really is a very Western model of therapy. One of the joys that I've had in being able to work with communities and CBOs for many years, and it's hard to say to somebody, okay, we're going to build because we're going to do gardening, we're going to do fishing, we're going to do canoeing. When you go back to the community will tell us what works. If you have somebody who's been traumatized, oftentimes, and sometimes if you ask them and talk to the therapist about their trauma, especially if you're using an interpreter, you only create a bigger problem. But when you ask them, not what is the problem, and we're as clinicians, we're trained to say, what's the problem so I can fix you? We rarely ask, where did you find your strength? What gives you the power to have survived? And I've had clients say, nobody's ever asked me that question before. And that's when you begin to realize it's through dance, it's through music, it's through food, it's sharing the culture. That's how we heal, not just through diagnosable conditions and talk therapy medication. As a psychologist, I was trained to do that. There's real power in that. But the community has, over the last number of decades, really taught me there's so many other ways that we heal. And that's why conversations like this are really important, to sort of open it up and say, don't be afraid to talk about mental health. If you're living, if you're breathing, mental health is going to pay you a visit one day or another. It's part of our lives, but you shouldn't be afraid of it. And that's where the wisdom from the community really comes from. So for the panelists, we're talking about culturally competent intervention strategies. I mean, I don't even like to use services sometimes or therapy because that has a particular implication. Intervention strategies. It could be lots of things. So I think that's the other half that we really need to pay attention to. Why is there such stigma around mental health to begin with?
Thank you for all those comments. There's a lot to take in, and we are seeing questions starting to come in, and attendees, we will get to the questions in a few minutes. A related question, and thank you panelists for your insights, and we look forward to hearing more. the mental health impact in our communities due to COVID-19 and related public issues and systems have probably impacted our communities differently. And can you speak to kind of how the diversity of our communities and the intersection and we're talking about has kind of resulted in the differential COVID-19 impacts?
I can start. I do not represent, as everyone said, I don't represent the entire Asian American Native Hawaiian Pacific Islander community, but I am a part of various organizations that support at a national level, like Filipino American organizations and communities, both here in the United States and in those in the Philippines. And what we realized really early on, even before the data said it, was that a lot of our relatives come here as nurses, as healthcare workers, as essential workers. And so data showed back in September and the fall that although Filipino nurses make up 4% of the nursing workforce, there was an outsized toll of 32% of nursing deaths being those of Filipino descent. And so what we've recognized, I will just speak from my own personal, like, anecdotal experiences. I'm part of an organization where a lot of us are Filipino young leaders from across the country, and we wanted to find that playbook that I mentioned of how do we support our families. And we created this task force meeting weekly to figure out what are people experiencing, what do our elders need? Do we need additional community support through mutual aid efforts nationwide? And we ended up creating and receiving funding just because of all the funding that was out there to create a help desk online. And it was a help desk for us to create community answered questions that related to COVID-19. Filipinos internationally are the highest Facebook users. And we found out that they were sharing many articles that were not correct. And a lot of misinformation was out there around COVID. And we saw that our family members were sharing it in various Facebook groups. And so we felt that rather than it coming from those sources, let's create a credible or help desk where they can ask questions around anything they're really dealing with. And that included, any mental health struggles that they were experiencing. And so I would just say, like, in terms of the Filipino community, things around just intergenerational conflicts were happening a lot. A lot of people tend to live in multi-generational households. And so trying to navigate that was a big thing that especially college students having to stay, or those that had to live with essential workers, would have to deal with on a day-to-day. And so providing listening sessions and just dialogues and forums through that help desk and offering it to the community was a way for people to just share on a weekly basis how they were doing. Another thing that we realized was those essential workers needed space to talk about what they were going through. And so supporting even the family members and having conversations with their essential worker family members to just check in the ways that they felt they were comfortable in doing so. And I would say, I think another thing was, the racial reckoning that we were also dealing with, having to go through just difficult conversations with family around anti-Blackness and what solidarity looks like as we are all also navigating this pandemic, was something that, at least for like the Filipino community, just talking about colorism and just our understanding of colonization and its impact on the Philippines and the diaspora here, those became conversations. And so those are just high level things that came about this past year. And I'm very happy to say that that help desk is continuing to run. We just brought on a new set of fellows to help us run the help desk, and we're hoping to get more support in other organizations that are providing funding for it.
If I can just add to that, Krystal, thank you so much for highlighting what I think one of the points that you brought up that I wanted to add to is the relationship between being a member of the diaspora and having family in the home country. And I think when we talk about the diversity of our communities, the way that COVID has impacted folks' home countries at different points in time also affected the mental health of members of the diaspora. So I know obviously COVID-19 started in China, and so we had a lot of Chinese American colleagues that were experiencing a lot of feelings of anxiety, of fear, of frustration, especially because they, were the ones who started thinking about mask wearing before it became socially acceptable in the US. And how COVID-19 has traveled across Asia has had severe mental health impacts on those of us in the diaspora in other parts of the world. And as somebody who identifies as an Indian American, knowing what's happening back in India with COVID-19, with severe underreporting, with lack of access to vaccination, ultimately does have an impact on mental health. So I think it's really important for us to think about not only what's going on in the United States with respect to anti-Asian hate and hate crimes against different Asian communities, but also what's taking place in home countries that's directly impacting members of the diaspora in terms of their mental health.
And I think what sort of adding on to both of your comments, what a lot of the general population may not be aware of is that the large percentage of Asian Americans in this country are either foreign born themselves or have at least one parent that's foreign born. So this isn't ancient history. This is literally our parents, our grandparents, our brothers, our sisters, our aunties or uncles. This is home base. And so I think that kind of direct impact we're seeing what's happening. It's like what's happening with India right now. And we're looking at the profound, just the loss of life and the pandemic, how it's taken hold. It's impacting individuals here. And another thing that we're seeing with communities around the country, racism is nothing new, whether it comes through the colonization, it comes through looking at the impact on the immigrants or the refugees. But what we're also seeing is that because we have such a diverse community, individuals are experiencing the issue of racism differently. And for some, and we've heard this repeatedly, where they don't dismiss the fact that racism exists, but they don't know what to do with it. And so it goes anywhere from somebody who goes, there it is again, I've had this over and over and over, it's happened to me personally. And others are going, I grew up in a part of the country, or I was never aware of either the microaggressions or things that are going on personally, and they're lost. And one of the things that makes racism really, really difficult to talk about, and many of us have said this, but there is no such thing as, well, your crime isn't as bad as this crime. A crime is a crime. And if you're a victim of that, it is painful. So it doesn't get us anywhere to say, well, this is okay. But what happens, which makes a hate crime more painful from a psychological standpoint, it's not a matter of being in the wrong place at the wrong time. It's being perceived as being the wrong person all the time. And we see this a lot of folks who then are afraid. We saw this a lot with the young kids that we're working with, who are afraid to claim their identity because it is seen as something that's wrong, that's bad. And you see this with the LGBT community, with some adolescent females. We're looking at a lot of different issues. And so racism really has affected people that are afraid to either report the crime because they don't want to acknowledge that they have been the victim of a hate crime based on just who they were because of their race or their ethnicity. So I think the whole racism thing, really, we're seeing a wide range of responses throughout the country of how it's impacting people and whether they want to just either dismiss it or they're afraid to talk about it, or it just goes to their heart and it's really, really painful and they don't want to talk about it. So I think it's another way that we're seeing diversity in the impact among the Asian American, Native Hawaiian, Pacific Islander communities.
Yeah, thank you for that. There's a lot to kind of take in. So if you are attending and listening and hearing things for the first time, there might be, so I think younger generations say feels, or you might have some feelings or thoughts and reactions. And so we definitely encourage you to take part in that idea board, look at the questions, and feel free to drop a chat. Just want to take a moment here to say, very fortunate to have this wonderful panel. I do have another question, follow-up question, and that is, when we think about what DJ just said about the impact of racism and mental health stressors affecting our communities differently, what do you think are some important factors or external reasons, it's not problems with our communities, but what are the things that are impacting us that perhaps are unique to some of our communities? Can you help us understand that a little bit more?
Yeah, man, I'll kind of go off of that one. So, I don't speak for all Pacific Islanders, but I know that for a lot of Pacifica nations, there's these really large themes of colonialism, impacts from war. For instance, we know the Marshall Islands, they're very well known for having their islands used for nuclear testing during World War II. And the bombs were actually more powerful than the atomic bomb dropped on Japan, which today is like the most people that have ever been killed from a bomb. So I think when we think about these things, those of us that you live in the United States, we have family that were directly impacted from these historical events. And it does impact our mental health because it's created physical health disparities. For instance, those bombs, it poisoned people at that time, and people continued to have children and give birth to children that continue to have health disparities generation after generation. So even though I think that the opposite narrative is often like, well, these things happened 40 years ago, 50 years ago, 100 years ago, studies prove that generational trauma is a thing and intergenerational trauma is a thing. These things don't last for the generation that saw it themselves. They trickle down, and it's like a ripple effect. It continues to impact generation after generation. And I think in addition to that, I know I kind of brought up a little bit before, but I think a lot of us who are children of the diaspora, we do suffer from racial imposter syndrome, which is when you feel like you don't really deserve to identify as a part of the ethnic group that you ancestrally belong to. So I think that in itself, it creates all sorts of new causes of mental health complexities or diagnoses or struggles or internal struggles. And I think a lot of that has to do with identity, obviously. I guess I'll share a metaphor because I think it's really good, but obviously there's always like these things we can do for self-care. We always say like, go to talk therapy, it helps, or, see somebody. But I always say like, as long as you have something that you can understand, it's always helpful too. But I've heard this and I've read this metaphor, but it basically stated that as children of the diaspora, we're like a canoe, and the canoe itself is made out of the tree from the island that it was at. And so that's where the roots originated. But no matter how far the canoe travels from home, it will always be made from that tree and its roots. So a lot of us who are children of the diaspora, that's how we are. No matter how far we go from where our family's from or where our ancestors are from, our roots are still from that place. So yeah, I think that that's important to think of. And I mean, like I said, it's not just like in the past, it's still very present when I'm talking about colonialism, I guess, but we have citizens that feel like they're losing their identities from certain nations. I know like the Northern Mariana Islands and Guam to this day are really the only two countries in the entire world who have not gained legal or recognized sovereignty. So I think there's a lot of answers to this question. And there could probably be an entire hour just based on that. But I do think that those are some of the causes that I would say are big ones or overarching themes for Pacifica that I've noticed.
Okay, just really, really briefly, because I love the analogy of the canoe, because one of the ways that we heal is being able to claim who we are. And you're talking about imposter syndrome, that is so common, but it's like we are in the canoe. That is our birthright. And when we're able to claim it and to feel safe and to be proud of who we are, in spite of what the world around us may be saying, that is a huge part. And that's what we said, that is mental health with a capital HEALTH. So I think that the canoe that's what's carrying us forward. So it's a great analogy.
And if I can quickly tack on to both of those comments, also love the canoe analogy. I think another challenge that those of us who are part of this, Asian American Pacific Islander community, one of the things that we struggle with in the diaspora too is understanding, quote unquote, where our place is in American society. I think a lot of us growing up have learned about race in a very binary way. Like obviously, when we learn about, segregation in the civil rights movement, you talk about white versus black, and that makes it very complicated, because if you don't identify as either of those things, then where do you sit in the overall hierarchy of American society? And trying to navigate what that looks like in different spaces can be really challenging. And I think really what's really important to think about too is how history is presented to us when we're children. It's presented in a very white-centric way. So when you get older and you learn about the fact that Asian Americans played a crucial role in the civil rights movement, and there was a lot of work done to advance immigration policy and other types of policy on behalf of Asian Americans, it becomes a sort of gaslighting, because you're taught for a very long time that Asian Americans were very quiet or were non-existent for a very long time, and then all of a sudden you learn that that's not the case. So I think that can also contribute to mental health struggles, because we're taught a specific narrative when we're children growing up for a very long time. And for those of us who are fortunate enough to discover the actual history of our communities, it can be really challenging to reckon with what we've been taught growing up.
Wow, that was a lot. That was deep. That canoe metaphor, beautiful. And but to think about all of the ways in which our communities, our families, ancestors have been silenced and erased from history that we're taught. For those of us who grew up in the U.S. and were socialized and educated here, I get mad now thinking about my grade school experience, my high school experience, my college experience, even my doctoral training was so absent of the powerful, intelligent, brilliant, and important contributions that our communities and people have made. So I that's what I was feeling as all of you were sharing that. One thing I'll say, and then we have one more question. We'll get to the Q&A. Is I think my experience as a researcher and in looking at Asian American cultural and racial experience in the U.S. is for those of us who've been raised and grown up in the U.S. and the system for some extent, internalizing the racism that is everywhere, and that is something that I think is that takes a lot of unpacking, and that it can be a real big piece of mental health, and kind of creating a new narrative that there's not something inherently wrong with someone who looks like you. It is a big piece of the process. So for those who are listening and attending and want to learn and know more, Krystal, I see your name by this question, so I will just ask you, where can we find resources, free resources and accessible resources for those of us who want to learn more for ourselves and for our families and for our communities?
That's a very, there are many answers to this question, and I know a lot of the other panelists as well have mentioned great resources, so also happy to have people drop those in the chat. One resource I do want to offer is, so the Asian Mental Health Collective had a conference back in January, the Transformation Conference, where they held about 8 hours worth of streaming on Twitch and YouTube and Facebook Live of different panels representing the community, YouTube stars, people in people that were celebrities to also people that were clinical. And every person was asked this question of, what are your resources? So I am going to take the easy way out of and send and drop it in the chat that specific list. It's a very exhaustive list of resources that I encourage everyone to look at. Yeah, AAPI Online is on there. I would say there are so many other organizations that really highlight and advocate for AAPI mental health, including DJ NAPIMA, if you want to drop that in there. NAPIMA, AAPI Online, Asian Mental Health Collective also has other coalition organizations there too. So encourage everyone to check that out. And specifically for young Asian American, Native Hawaiian, Pacific Islanders that are on campus, Active Minds, JED Foundation, and Steve Fund specifically support those that are on campus or that are in this K through 12 education system. So definitely encourage that. And I was about to say that Anjana, I would say Instagram in general has created a lot of different Instagram accounts of people that, it's not therapy, let me say that, but it is a lot of a lot of resources and directories that can help people find, whether that be therapy to different like groups that you can talk about these mental health challenges with. So Brown Girl Therapy, Inclusive Therapist is another one, Asian Mental Health Collective, API Mental Health Project, and Dr. Terapanai is specifically for those that identify as Filipinx, are all Instagram accounts. So all of that and all the things that are in the chat would be great starters.
Great, and thank you for sharing those links. So is that Transformation Mental Health Resources, is that something we can all share?
Yes, that is something you can share widely.
I just
it is, yeah, it's a long list from all the speakers who are part of that conference.
Yeah, that's a great resource, and I'm sure all the attendees already know this. I'm out of date with tech, but if you save the chat, all of these resources, you can just go back. And I'm sure everyone already knows that, but for those like me who are just recently learning that, I recommend saving the chat so you can access these excellent resources directly. So thank you, panelists, for those excellent perspectives. We're going to move now a little bit to ask some questions that were raised by audience members, and those of you who are listening, feel free to put more questions in here, but I'm going to go to the first question here. And panelists, feel free to respond or not. How do youth talk to their parents about getting help for mental health issues? Any recommendations or insights there?
I think whether you're talking to a parent or anybody else, one of the first things to be really sensitive to the fact that it can be very difficult, a difficult topic. And you want to do is sort of normalize it. And you don't want to go, oh, you're having a problem, you got to go talk to somebody. And it's also just being able to say, sometimes it's really hard and people experience, and it's kind of hard to talk to somebody, but it can be really helpful. So when you do is you normalize. If somebody's feeling tense, is feeling anxious, is feeling really depressed, because you want to take away that sense that there's something wrong with them. And so when you do that, and then just be willing to sit, not in judgment, and to listen to them. And sometimes it's really hard, and we do things even with the best of intent, and we say things that we don't mean to. And very common things that we say is, oh, it's not that bad, which means it might be heard as, oh, well, I'm making this up, you don't take it that seriously. Or, and then you bring, but I did this. But we, just very simple kinds of things about, I wish it didn't hurt that much. And I wish, so what you do is you respect the feelings, and then you sort of go from there, but you don't discount the feelings, even though the intent is to say, it doesn't hurt. It's like, I wish it didn't hurt. So again, part of respecting where they're coming from, normalizing it, and then making it safe for them to talk to somebody.
Any other thoughts, panelists? And DJ, was that the perspective of parents helping their children talk to them about race or about mental health concerns?
It could be either. And okay. One of the things too is, I think whenever you want somebody to get help, you want to, again, create a safe space for them to feel like it's okay for them to talk, and to also know, and this is sort of everybody's homework assignment, know where to go for help. So the resources that Krystal was talking about, NAPIMA has on its website a list of places to go to. If the first time you hear about this happens to be in the moment, there's nothing you can do about it. But if you are aware of it, then it's like, I don't want you to be alone, but I can be here as your daughter or as your friend or as your whatever. But sometimes it helps if you talk to somebody who's really trained to deal with this. So you can make that reference over. And then there are a lot of other things which you won't have time to go into now, but that's why we start looking at the different ways that the community heals, because they still may be uncomfortable talking. But that's when you create healthy communities. So this is actually, it's a simple question, but it's a very complex question. But it's a very doable question if we just sort of broaden how we think about the issues and what we can do about it. But the main thing is you create a safe space and you listen. And if it's around racism, and I definitely, actually, I'm going to close it, let others kind of, they've got some really good ideas about how you may talk about a specific issue or just getting help in general. So
I think this kind of goes back to the question about why there is stigma against mental health in our community. And part of it is, you know, if this is something that you're dealing with, you should be able to share this with your family. And the moment you go outside of this protected family network, you're exposing yourself to dishonor, you're exposing yourself to, you know, a stranger knowing all this information about you. And I think the way to kind of combat that to a certain degree, at least for me anecdotally, has been, you know, I think we're all dealing with a lot as a family. And if we just continue to rely on ourselves and rely on each other, at one point that will become emotionally untenable.
mm-hmm.
And so I think if you're able to frame it that way and to say, you know, of course, we're a family, we're in this together, we should be able to go to each other when we're experiencing, you know, trauma or difficulty, that's all well and good. But there will be a certain point at which that will not be enough and will actually, we might even end up in a more adversarial relationship than we were before. So I think being able to frame it from that perspective, that you're still respecting their role as a family member and as somebody who cares about you, but you also want to protect their capacity, that may also be helpful.
I think it's also important to keep in mind that it's probably, you're not necessarily going to be able to get through in just a single conversation. You're probably going to have multiple conversations and feel like you're repeating yourself before you finally get the message through. And you know, I work with, in my therapy work, I work a lot with young people, both high school, college age. And if you're lucky, as a high school student, you have school counselors in your school who can help support you or direct you to, you know, resources. But in my experience, a lot of young people are entering therapy, seeking therapy for the very first time once they are in college, once they're, you know, because they're finally adults. There's more confidentiality in terms of what is said between them and the therapist. And unfortunately, for some young people, you just need to wait until you become an adult, you know. It's not the most hopeful thing to hear, but if you can like hang in there and at least find some other adult in your life who you feel supported by, I think that's really important.
Mentors play a huge role, and the research shows that mentors can be very, very therapeutic. So if they're after school programs, and you want to make sure that the mentors understand that there are cultural differences. And one of the things that we saw over and over is the mentors, particularly working with a lot of the Asian American kids, is that they would sometimes inadvertently, because they love that relationship, didn't realize they're replacing the parents because, oh, my mentor speaks English really well. My mentor doesn't, you know, do or say weird things. So it's really important that mentors are trained to be culturally sensitive and not that their role is to be there as a mentor, not to replace the parents. And if they're not aware of these cultural differences and a lot of the cultural ways of interacting, they can somehow actually put a wedge. And it might be an invisible wedge, but it's there. So training around culture never disappears. But getting adults in there can be for that reason, because a lot of, and for a lot of them, they will open up only in college because it's safe. They're away from, and particularly as a perpetrator in the home, and I'm not saying that's the cause for all of it, but it could be just, or that they finally feel like it's okay for me to finally talk because I don't want to burden my parents. They've been through so much. I don't want them to see how much I'm hurting. So they can be very protective, and that's a safe time and a safe place for them to talk. But sometimes we might lose them before they get to college, which is the other fear. If you want to make sure they don't get lost in the shuffle.
Yeah, thank you for sharing that. And Jennifer, I really resonated with the idea of the ongoing process, not a one-time event of having the conversation, but also like the reality of engaging support where you can find it. whether that's in person with your cohort or your friends, but online communities. You know, again, I'm an old timer. So 2 years ago, I didn't really believe in the reality of like real connections online. But what the last 2 years has taught me is that I've had profound moments of connection with people I've never met in person. And I think that is a real, you know, that's mental health work evolves. And I think that that's a reality of support and access. So right now we are engaging with each other from across the country and having a moment. So, you know, whoever asked that question, if you're wanting to have that conversation with your parent or caregiver, I hope this was helpful. And I also hope you can find support. I'm going to move to another question here. This one was written, Angela, but I believe the panel can speak here, talking about specializing in racial imposter syndrome. Can you talk about how that affects the Pacific Islander community, both on a mental and cultural level? And then we can maybe, Angela, if you can answer that, and then we can open that to broader communities for the panel.
Yeah, I think the interesting thing about it is that it's obviously not just present in Pacific Islander communities. A lot of, you know, BIPOC persons in our communities feel this way. They feel like they're experiencing it. And I think there's definitely levels to it. There are people who feel like they don't belong to their own ancestral culture. There's people who feel like they don't really belong in American spaces. And then there's people who feel like they don't really belong in either one and that they're straddling these two worlds and don't really know where they belong. So I recommend talk therapy, and I think it's because I'm biased, so I will say that because I'm a mental health therapist. But I think the big thing is just realizing that it's not really a deficit. It's more of a strength. And I think that I obviously experienced racial imposter syndrome growing up. And I think when I started realizing that it was a strength was realizing that I was a bridge between the two worlds a lot of the time. So I do recommend therapy, as I said. I think for Pacific Islanders, culturally, it's a great route to go if you feel like you are feeling that way. And I say that because even though mental health diagnoses, mental health help can be seen as negative and has a stigma in the community, I want people to remember that Pacific Islanders have always said that we talk stories. We're always talking stories. And that's always been our way of communicating and growing and just becoming more healthy. We've had our communities have healers in them. So why is it not silly to think that there are people who are healers who do it on a mental health level or a spiritual level or an emotional level? And so for me, I use narrative therapy. So if people wanted to look into a therapist who specializes in that, it comes from New Zealand, where there's a lot of Indigenous Pacific Islanders, but it helps rewrite the narrative of your story. So like I said, instead of thinking that it's a bad thing to feel like you're straddling these two worlds, you're rewriting your story to understand it's a good thing that you're straddling these two worlds. And storytelling is such a key part of Pacific Islander culture. And so often in history, our stories have been written or told by colonialism and by people who are not a part of our own community. So I think it's a huge part of our identity in itself, just to understand that it's your right to tell your own story.
I'm sorry to interrupt if there's another panelist, I hope, but I really resonated with that storyteller piece. I'm a mental health professional. I'm also like a amateur filmmaker, and I believe that like all of us are telling stories, and whether we're helping a client retell their story, but storytelling is so powerful. So that was wonderful. Thank you. Any other panelists can share with us racial imposter syndrome and how that might manifest in our communities and how we might unpack that?
If it's okay, I want to add that imposter syndrome can apply to a lot of different identities, not just race, right? And so especially for folks who have multiple intersecting marginalized identities, there is that like marginalization within marginalization within marginalization. Like if you look at, for example, queer Asian identity together and feeling like, oh, am I queer enough? Am I presenting in a way that is acceptable or it will be embraced? In that, so it can apply to a lot of different things. And I agree with Angela. I'm a little bit biased too. I think therapy can help explore those things.
And I just wanted to clarify, when I say that there are a lot of answers from the community, it doesn't mean that I'm not for a talk therapy, because I totally agree with you. If you have a good therapist, talk therapy can be really, really powerful. But also the way that you're describing it, I love it, because talk therapy can be telling stories. It's talk story. There's lots of different ways that we use the talking to get through it. But so I just wanted to clarify that I'm not against therapy, because it is a very powerful tool, but it's also really having a full understanding of what the cultural pieces are. And in addition to that, there are other ways of healing. So, because I totally agree with you. And I love talk story.
On the note of talk therapy, I know that in the past I've heard from my own experiences and those that are seeking therapy that it's hard to find culturally competent therapists. And so I dropped in the chat one specific organization right now that is really helping people find BIPOC mental health professionals nationwide and connecting them and offering them for free virtual teletherapy sessions, specifically for teens and young adults. So if you're in that age range, I've personally used it as well as others I've known, and it's been great to find people in the local area. And Asian Mental Health Collective is really looking to the COMA project as a model, so that we're currently in the development stage of creating free subsidized therapy for the NHPI community. So that's not coming out though until the fall season. So be on the lookout for that.
It is such a valuable resource, and I'm really, really glad you guys are doing that. I think it's just excellent. Really, really good.
That's Dr. Alfie's work, correct? Yeah,
yes, that is.
One of the privileges I have as an academic is getting to interact with some excellent people, and I look forward to this summer. There's a symposium I'm doing with a COMA project and Dr. Alfie. So that's an excellent resource. Thank you for dropping that in chat. You seem to be the resource person.
She is.
So no pressure. We do have one more question. I want, before we move to, I just wanted to say, years ago, I had a colleague who is a good friend now tell me, you know, because for those of you who are wondering why someone who looks like me has a name like mine, I'm a Korean adoptee. And years ago, trying to make meaning of my experience and talking to this person about I'm not Korean enough. And this person said to me, he's like, there is no one way to be Korean. That was a healing moment for me. And I feel like I've come across people who, there's another author, writer, R.O. Kwan, who talks about we need to stop telling people, like, be the people who decide who's in our group or not, or what it means to be Korean or whatever community you're in. And I think those are the degree to which we've internalized the message of I must be these things to be this label or to fit in, I think is a thing that can really have a negative impact on our health. And so retelling a story and crafting a new narrative is really critical through talk therapy and other ways. All right, I think we have a couple more minutes for this question. And this is, given remote and hybrid educational approaches, how can we better equip and educate K-12 students to not only recognize but dismantle threatening stereotypes about our community? So how can K-12 students disrupt kind of the oppressive beliefs or ideologies or views of maybe about our community members?
I think that one of the challenges, of course, given remote and hybrid learning models, is it's much more challenging to read facial cues, social cues, and all of that. But I think in general, a good rule of thumb is to approach anything that you hear that sounds problematic, for lack of a better term, from a place of curiosity. And I recognize that that does take a certain level of emotional labor. But if you are able to commit to that level of labor, being able to ask someone or even ask the teacher, oh, like, I'm really curious about why you chose this example, or would love to understand more why you talked about this community in this particular way. And I think if you do that in a way that prompts an honest discussion as opposed to approaching it from a place of accusation, then you might be able to understand why that person brought up that topic in the first place. And more often than not, that person may not even realize that what they're saying is harmful. So it becomes a learning opportunity, not just for you and that person, but also for other folks in the virtual or in-person classroom. So I think leveraging a psychologically safe space, hopefully your classroom is a safe space where folks are able and are encouraged to ask questions, but being able to approach anything that you see as problematic from a place of curiosity is I think a helpful first step.
One of the challenges this country is facing right now is whether racism should even be taught in the classroom. And that is a huge issue, that to teach it is un-American. So we're talking about structural racism. I think that's another, we shoot the issue up to the systems level. When a large part of our country is afraid of or is totally against even talking about the issues, it makes it really, really hard. So I think we also need for people to understand that when we talk about it, we're not saying that this is a bad country. We're saying this is a country that has a lot to offer, but it's made a lot of mistakes. And the only way we really live up to our ideals and to live up what we have the potential to be is to look at where we've been. And you would do that whether it's at the individual family level with your partner, within the community, or at the national level, at the systemic level. And it scares me sometimes because I see that we have made strides, but I also see the fight that we're having about whether people will even allow it to be taught in the classroom. And that scares me because that means that we will then hide. Everybody on this panel has part of our histories that's been impacted by racism, colonization, something that has been very painful to us. And when we hide those, then we can no longer find a way for us to safely say, but this is who we are. So it's a big battle. So I don't want to be Debbie Downer, but I get really depressed when I watch the news and I'm going, how could you not want to teach this? Because that's a huge issue for us to be able to come over it. But at least on the individual levels, we can still, be allowed, but if they're going to make it illegal for you to teach in the classrooms, then we have to fight that.
Yeah, I appreciate your responses, and Anjana, your point was so gracious, and it really, I think, is aspirational. And I think a lot of times people don't deserve that level of graciousness. My initial response is always like, I want to yell at them. So how do we navigate that, for the students in the classroom or for us in the classroom, and we see that. First of all, it's like unfair that we would have to do that, but sometimes that, so how do you balance doing that as a teaching and gracious moment of calling in versus out, but also saving our mental health? Because I feel like for me, I am a less enlightened individual. For me, I can't always exist in that space because sometimes I don't have it in the gas tank to provide that. So how do you balance that level of kind of offering the grace or not?
No, that's such a great question. And I think I want to be clear that this is not a recommendation that like everyone should feel like they have to take, right? It may not be an approach that works for everyone based on personality and experience. But I think knowing where to go to fill your coffers on a regular basis is a helpful place to start. So I know for me at my workplace, one of my very close colleagues is also Asian American. She identifies as Vietnamese American. So it's really interesting because even though we are both Asian, we represent different parts of the Asian American experience. And so being able to talk with her about a problematic thing that somebody said at the hospital about Asian patients or anything else is what gives me the fuel and what gives me the ability to approach problematic conversations with that level of grace. I also recognize that for some folks, even that may not be enough to start those conversations. But I think knowing what, and this kind of goes back to Jennifer's activity, right, about self-care and community care. Where do you need to go to fill those coffers so that if you need to have a gracious teaching moment, you're able to produce one?
Oh, thank you. Appreciate that response. You know, the idea of support and coalition building is important too. My personal experience has been when people maybe who aren't in my community but speak up on my behalf in a way that is helpful, that allows me to kind of build myself back up and then speak up at another time. And that to me is like the ideal reality that we can hopefully be in at some point. And that it's not always our personal responsibility, but when we are in a position to, that there is great benefit to speak up. So well, I think in order to keep us on track, for those in attendance, can you please drop your love and thanks in the chat? Make sure panelists and attendees is selected to this wonderful panel who is given of their time and shared their experience. And that being said, I am going to hand this off to Thao.
Thank you. And yes, definitely echo that. So much gratitude to all of you, Matt, Jennifer, DJ, Angela, and Jana, and Krystal for the thoughtful conversation this evening. Also, thank you to everyone for joining us today. Before you log off, we have a few important pieces of information that we want to mention. First, please don't miss our upcoming events. Next Wednesday, we have our 4th WLP session, Google Knows Me Better Than Me, AANHPI Data and Privacy, where we'll talk about current data and privacy law users, particularly with online platforms such as social media, search engines, news sites, etc. Key topics of discussion include the effects of data collection and tracking, boundaries surrounding online privacy, targeted ads and disinformation, effects of increased targeting on user behavior, and the ethics of data ownership. Please also check our website on how to register and to view all our upcoming programming. You can visit our website to learn more about us at CAPAL.org, CAPAL.org. Follow us on Facebook, Twitter, and Instagram at CAPALDC, and find us on LinkedIn. We would like to take a moment to thank all of our 2021 sponsors as well for the continued support in our programs and helping us to continue to provide opportunities for AANHPI and public service. Initially an all-volunteer organization, CAPAL has served more than 600 scholars and interns and awarded over $360,000 to support public service careers for both undergraduate and graduate students. Our board members, scholars, and interns have gone on to serve as senior leaders across government, from executive, legislative, and judicial branches to federal, state, and local levels, as well as prominent policy and advocacy organizations. Your valued financial contributions will help expand this work. To donate, visit CAPAL.org. We also ask that you spread word about our scholarship and internship program. Opportunities for undergraduate and graduate students open every year in November. Please consider if there are any AANHPI students you know or organizations who may be interested, and please tell your University Career Center about us. If your organization is interested in sponsoring us, contact our Managing Director, Sham Ahmad, for all sponsorship opportunities. And finally, we are always trying to improve our programming to meet the needs and expectations of our community. There's a short survey linked in the chat that should take me no more than 2 to 3 minutes to complete. Your honest feedback will be extremely valuable to our future programming, and your contribution is much appreciated. Again, thank you to everyone for joining us, and I hope you all have a good night.